Welcome back to Tune Up Tuesday. My name is Joe Gambino, and today we're going to go over the lower body and spine cars as a continuation of last week's video. Just to kind of reiterate the reasons why we do cars, because I know many of you will not remember from last time if you saw the video. We do cars mainly to maintain joint health and range of motion, to teach ourselves individual control of each individual joint that we're going through, and also to assess ourselves from one joint to another. So you always kind of figure out what areas of your body need the most mobility training. So today we're going to start with the spine, and we're going to use the same tension techniques that we used last time in the last video. Meaning whatever areas that we're not trying to move, we want to keep tense. So for the part of doing the spine, we want to keep everything from the hips down tense, because we do not want to see the hips move. Because typically, wherever the head goes, the hips want to go opposite. But for us to only move the spine, we're going to need to move the spine without the hips moving. So what we're going to do is we're going to keep tension from the hips, squeezing the glutes, the quads, and we're going to corkscrew the feet into the ground. Once you have folding forward, once you can't fold forward anymore without your butt going back, you're going to rotate to the right. When you can't rotate anymore, you're going to extend your spine as far as you can without the hips coming forward. You're going to peel back the left shoulder into extension. You're going to twist to the other side. We'll fold forward and come back to center. We're going to do that one more time in the opposite direction now. We're going to rotate to the left, extend our spine, peel back the right shoulder now, come all the ways across, down, and back to the front. Typically I'll do 2 per side. This way you can kind of get a feeling for which side may feel tighter or you have more restrictions. After we go through the spine, I typically move to the hip. You can use a broomstick or some sort of pull for some tension. You can use a wall or anything that you can to get your hands on so you don't topple over if you're having trouble developing tension on your own. So for the hip, what we're going to do is we're going to come up as high as we can into flexion. We're going to come out to the side as far as we can. Rotate in, back, and down. Trying to move our hips, keeping our 2 hip bones always pointing forward, not allowing rotation or overly arching our back. Once you do the right side, or the left side rather, we'll move to the right side, coming up nice and high, coming out, keeping the hip bones forward, taking the foot, trying to get it as high as you can without dropping the knee, bringing it into extension. Again, 2 per side, checking to see which side feels tighter. And then that will leave us with the knee cars and the ankle cars. We can come down here. All right, for the knee cars, what we're going to do is we're going to take we're pretty much going to be trying to move the tibia down here in relationship to the femur here. So what we're going to do is we're going to try to find this little bump of a bone here on the tibia. So if you start from your kneecap, which feels like this little hard bone here, and then you come down, you're going to feel this little soft area. And then if you come down again, you're going to feel another little hard bump. That's going to be our landmark. We're going to take our outside arm and hook our leg, hold it up at the place here, and then we're going to take that bone, and it's a very small movement, but we're going to try to rotate it out. So now my finger ends up on the inside of that bump on the tibia. Then we're going to straighten our knee as far as we can, twisting from the knee inwards and back down. Then you can reset, go in the opposite direction, start rotating in first. So now that my finger falls to the outside of that bump, kick back up, rotate out, and come back down. 2 in each direction, on both sides, and then finishing up with the ankle. Now before we were trying to get this bone to rotate, we want to keep this bone perfectly straight. So there's going to be no twisting out with the foot, so we can separate the motion from the foot and the motion from the tibia here. We're going to start with our foot. We're going to press down on a gas pedal. So you're going down as far as you can, keeping it down there. We're going to rotate in as far as you can without letting this bone turn out. Come up as high as you can. Come across to the other side. Down and forward. That circle going outwards. Then you can come inwards, coming in, up, out to the outside, and back down. At all times, especially when going inside and outside, not letting the knee or the tibia rotate with the foot. Give those things a try, test out the lower body and see how it relates to the upper body. Now you guys will have a full body routine to do every day as far as trying to keep your joint healthy and assessing yourself. Until next time, I'll see you guys next Tuesday.